Good afternoon, and welcome to our RIA conversation today. My name is John Green with AMBA, joined by Amber Blummy, who is also a member of the AMBA team. We'll talk a little bit about who AMBA is here in just a moment. But while we have folks logging in, just do a couple of quick housekeeping details. We're going to talk all about long-term care, but we want this to be a very interactive session. You'll notice that just Amber and I are on the screen. That doesn't mean that we don't want to hear from you. Participants are in a listen-only mode, but we do want to have your questions. So if you've got a question, we have disabled chat. We want you to put those into Q&A, and that is simply because for two reasons. If it's a question that is very specific to your situation, we may type back the response to you. We may not know the answer, and we can get back to you at a later date with that transcript that we record there. So please don't ask your question anonymously. Please ask it with your email. At least we can get back to you and respond to you. If it's a question that we're going to address later on, we'll probably hold that. Or if it's a question that is best answered at the end, we'll do those questions at the end as well. But we want this to be very interactive, especially about this topic. We know we've got members of RIA all across the country that have joined us. You may be at different ages and different stages in your life. And the issue of long-term care may be very acute to you right now personally because of a parent, because of yourself, or in the future. So, everyone has a little bit different need here, and this situation is very personal. And so we want your questions to be answered that way as well. We do record these sessions. We've already had members that said, hey, I'm going to be able to make part of it, won't be able to make all of it. Can I watch it somewhere else? We're doing two things. We're recording this session. We'll make it available out on the RIA website. And then possibly Dawn or Jessica, someone on the board, could send it out to everyone who attended or maybe registered and didn't attend. That way you can follow up and watch it, get more information, share this with a loved one. I think about this. I mean, if you go out in the stores right now, it's back to school sales, but we're starting to see these Christmas in July sales. Makes me think about the holidays. This particular subject comes up a lot around the holidays. You're sitting around the table with family, loved ones, and say, what would happen if we had to take care of mom, things like that. So you may want to refer this to this conversation at a later date as well. So let's go ahead and jump in and have these conversations. If you've got questions, again, drop those into Q&A. We want to make sure that you get all your questions answered on this conversation. We're going to pack a lot of information into a short period of time. Again, my name is John Green. I work with AMBA. I'll describe who AMBA is here in just a moment. I live a little bit north of Houston with my family, who is a bunch of educators. All my wife and my daughter and daughter-in-law are all getting ready to go back to school, but I have spent the better part of my career working with educators to help them understand what retirement is like. I do appreciate the opportunity to share with RAA members and alumni members across the country a little bit about some of the things that we do at AMBA. At AMBA, we partner up with associations, including alumni associations like RAA, to help provide extra benefits, maybe things that you can't get through your current place of employment, maybe after you retire and you lose those benefits, but it's just another value add that RAA provides for their alumni. And we're proud to be part of that, proud to be part of the educational experience as we walk through this conversation today. And today, we're going to identify the myths and facts around long-term care. We're going to discuss the need for long-term care, maybe some of the traditional components of a long-term care plan. I'm going to take a quick poll here in just a moment and try to find out kind of where you are and what you're doing and the ideas. We're going to talk about the cost of care, some of the solutions that may be out there. I want you to grab a pen and paper because I'm going to show you some websites, give you some numbers, things like that, help you make the most of the options that you have currently through your alumni association, and maybe some things you hadn't thought about before in the past. So let's go ahead and launch a quick poll here. See if I can get this kicking here. And I want to go down and look at this one here. All right. I'm going to launch this poll. It's totally anonymous. When you're thinking about planning for your future and you need long-term care, we're going to talk about the stats on that. How do you plan to prepare for that? How do you plan to pay for that? And again, totally anonymous. We want to make sure that everyone has a chance to answer this question, that it'll help Amber and I understand who's on the call, what you may have, what you may not have, and what you're thinking. So we'll take just a few more seconds here. We've got about 60% of the folks have joined us or have already responded to this. And then we'll compare these numbers against what the national numbers show as we go through here. So, all right, Last call. We've got about 5 more seconds. 5, 4, 3, 2, 1. Okay, I'm going to go ahead and end the poll and share the results. So we've got across the board here. We've got kind of an interesting group here. We've got about a third says I'm going to spend my own money for my care, and that's great. We'll talk about that. Then we've got some that have said I'm going to have my friends and family take care of me. Just one or two of you. That's an interesting concept, and I will tell you that person is probably the most honest of anybody in here in the group. We've got a group of you, about 17%, that said I have a long-term care policy. And let me applaud you for that. You've taken the steps necessary to take care of yourself and your family. I'm going to share my personal experience here in just a moment. And then probably the most honest groups of the bunch, about half of you said, I don't know what I'm going to do. And that's okay. You're starting in the right place. Because your alumni association thinks so much of this topic and about you as members, they want to help you prepare for that. So stop sharing there. Let me go ahead and jump in this conversation. And this is why. This is why I'm so passionate about this discussion. This is a picture of my father and I back July 5 years ago. In 2020, he had just turned 80. He was living in a memory care facility in Austin, Texas. He had moved to that facility about 3 months beforehand. He had been in a nursing home for about a year and a half prior to that. This was the last time that he remembered who I was. I'd come to see him on his birthday. He had just turned 80, and it was the last time that he remembered who I was. He passed away from the effects of vascular dementia in October of 2020, just a few months after this picture was taken. But because my father had thought so much of his kids, my stepmother, his stepkids, to take out a long-term care plan many years in advance, my family was blessed because of that decision. He was the most athletic man that I ever knew. He was all state in 3 sports in a small high school in Texas, ran track for the University of Oklahoma, played competitive basketball well into his early 60s until a series of small strokes robbed him of that ability, which then ultimately led to his vascular dementia. So, what I'm going to talk about today, I'm going to filter my conversation through my experience. If you've had experience taking care of a loved one who has needed care, you'll understand why you're passionate about this subject and why I'm passionate about this subject. So let me filter that through this conversation today and just talk about the current situation when we talk about long-term care or nursing home care or at-home care. There's some good news and bad news in the overall picture, and then we'll jump into talking about it, because the good news is advancements in diagnosis and treatment are driving life expectancies up. We're able to catch things earlier. We're able to treat them earlier. And so therefore we're living longer. And as a result, we're also seeing a variety of care options increasing. It used to be you either stayed at home or you went to a nursing home. There are so many options in between now. We're going to talk about that as well. On the flip side, as we get older, more people need care. And that just a simple economics, the supply and demand, more people needing care drives the cost up. At the same time as we are aging as a population, we are seeing smaller families, which reduce the care pool. I think about all four of my grandparents. All four of my grandparents, they had 7 to 10 brothers and sisters in their family. So if somebody needed care, there was somebody in the family that could take care of mom, somebody that could do something to be able to take care of somebody in the family. We have smaller families, 1, 2, 3 kids is the norm these days. Then also, especially for those of you who have a long-term care plan, we're starting to see different companies restrict policy language. They're responding to Medicare changes that are making it difficult to get long-term care. Then we're seeing increased premiums and coverage changing, things like that, larger elimination periods. We'll talk about what that means. And then we saw the impact of COVID. My father was in a nursing home in Marble Falls, Texas, outside of Austin when COVID hit. And I learned so many things that the government had to change around nursing home care as a result of COVID. And that drove up costs and the cost of care as well. And we saw many families try to get their parents out of assisted living facilities and nursing homes to bring them home to not get them exposed to COVID. All of those things added up that way as well. So where we may find for that 17% of you that have an old policy, You may find yourself receiving letters from your carrier that says, we're going to raise the rates on your long-term care policy, or we're going to offer you a level premium for a reduced amount of coverage. Or what we see sometimes is that people who have an insurance long-term care policy right now, they took it out when they were working, they took it out when they were younger, and to make it less expensive, they chose a longer elimination period. And now they look at it and say, wow, I don't know if my coverage matches what my future costs or my needs are going to be there. And then we saw some older policies that had very restrictive language on home care. And so most people want to get cared for at home, but sometimes those policy coverage doesn't match the needs that are out there. So we're going to walk you through some of these things. But what hasn't changed, no matter all the good things, the bad things that have happened as a result of COVID and some of these changes, the reality is that once we reach age 65, 70% of us are going to need some type of long-term care service in the future. That doesn't necessarily mean like my father, who spent the last 2 years of his life in a different type of nursing facilities. It could mean the results of a hip replacement by breaking your hip in a fall or a car accident. It could be a shorter period of time, but we're going to need care beyond just that hospital recovery. So when you think those things in your mind, you think, well, how does a long-term care plan work? What happens out there? Let me share with you some of the numbers. These are the current realities in long-term care. The average time that someone receives care is 3.2 years. For women, it's longer than that. For men, it's shorter than that. For my father, the number was spot on, about 2.2 years for a male to stay in a nursing home. For women, it's about 3.7 years. However, what we're seeing is an increase in the number of residents in a nursing home that require care for 5 or more years. This is because we're seeing Alzheimer's climb. The greater incidence of Alzheimer's, people whose body is healthy but their mind is not, that's causing a lengthier stay in nursing homes or requiring care. As a result, we're spending almost $500 billion annually on long-term care. Now, a small portion of this is borne by long-term care policies. The other is borne by us as either recipients of the care or family members who have to care for a loved one as well. So did you know those stats? Think about your family, medical history, things like that. That will kind of help inform our conversation as we go forward today. Now, what I want to talk about, just to give us a base level understanding of what long-term care looks like in terms of an insurance policy. We'll get into where it covers things like that in just a moment, how it works. But I want to show you this, and I want to illustrate it in the form of making a good hamburger. You know, when you make a good hamburger, what qualifies it to be a hamburger is the buns on top. The meat inside by itself is just a chopped steak. So you have a good buns, and then you build your sandwich or you build your hamburger and customize it to make your burger. A long-term care policy operates the same way. To qualify your long-term care policy, meaning to trigger or to go on claim or to pay out, make payouts, you have to have one of two things happen to you. You have to lose activities of daily living, such as bathing, getting yourself dressed, being able to go to the bathroom by yourself, feed yourself, or transfer out of a bed to a chair to a wheelchair, something like that. Most policies say that you have to lose 2 or 3 of the activities of daily living, and then you can go on claim. You can qualify for your coverage. On the other hand, you could have a cognitive impairment, such as dementia or Alzheimer's. When you get diagnosed with that, that can also trigger your policy to go on claim. So to give you an example, with my father, when he had early diagnosis of dementia, he could do all of his activities of daily living, but he was at risk to get up in the middle of the night and wander off or magically become an electrician, which he was not trained for, try to do work around the house and hurt himself, things like that. So the long-term care policy that he had kicked in because of his cognitive impairments. So again, those are the 2 things that qualify you to then go on claim and qualify for long-term care coverage. The daily benefit, the meat of the policy, is really where the money, so to speak, comes in for your claim. Some long-term care policies are daily benefit amount, meaning you get 100, 200, 300, whatever dollar amount per day when you go on claim. Others are a pool of money that says you've got X number of thousands of dollars to pull from for your care. And once that's exhausted, you have no more claim that you can file. When you take out your policy initially, if it's a daily benefit amount, you have a length of coverage, which says we're going to cover you for 1 year, 3 years, 5 years, 10 years, or lifetime. Very few policies anymore are covered for lifetime benefits because Alzheimer's rise has gotten so prevalent. It would be difficult to calculate how to pay for that. The length of coverage tells you how long your claim will be paid. Or again, if you've got a pool of money, it tells you your pool of money will last this long, or this is the amount of money you can draw from. Once you exhaust that, your claim is over. Then the elimination period comes into effect. The elimination period acts just like a deductible on your homeowner's insurance policy. So, say you have a homeowner's insurance policy and a hailstorm comes through, and it says you have to pay the first $1,000 or 1% or 2% of your claim or your home value before the coverage kicks in. The elimination period says you have to have lost your activities of daily living or have a dementia or Alzheimer's diagnosis, and you have to wait 30, 60, 90, or even 180 days before you can start to draw money on your policy. The longer the elimination period, the less expensive the policy is, but that's a lot of money out of your pocket that you have to pay. Then you get into additional coverages that may not mean anything to you now, but can really make a difference when you need claims. One is location of coverage. Can you get covered at home? Can you get covered at an assisted living facility? Or is it just nursing home coverage? Non-skilled services. This is a big one, especially in the early stages of my father's dementia. We just needed someone to come in and stay up at night in case he wandered off. My stepmother still worked, and so he needed someone that could protect him while my stepmother slept. With non-skilled services, some policies will pay for that. Other policies will only pay for a true licensed home health care skilled nurse to come in. And then finally, inflation protection. Inflation protection is probably the most misunderstood part of a long-term care policy. It is something that when you take it out initially, you don't think about it. You may say, yeah, I like some inflation protection on there. What that means is whatever that pool of money or daily benefits you took out, over a period of time, it grows for you. It could grow by a flat interest rate or a compound interest rate, or you could get letters from the company that say, you selected inflation protection on your policy. You have an option to buy an additional $30 a day worth of coverage or a certain amount of coverage without any underwriting qualifications. Would you like to invoke that? You check a box and you send that back and it says, yes, I want that coverage. Your amount increases, you pay a little bit more, and you go on till the next letter comes. Some people, however, get a letter and they say, no, I don't want this inflation protection. I'm going to check no and send that back this year. Company says, no problem. They send you a letter next year. Would you like this inflation protection coverage for the coming year, for the future? Yes or no. If you say no, then usually most companies only let you take that offer twice. After you decline that offer twice, you can no longer have the offer for inflation protection. So again, just to help you understand, those are the components of a traditional long-term care policy. We've had some questions come in. We'll hold some of those till the end to make sure that we answer all of these for you. But I appreciate you putting those in Q&A. It really helps us immensely as we go through here. So when we talk about long-term care or extended care, it's not just nursing home care. I want to point that out. It was a big deal for my father, could be a big deal for you. Most people don't want to go into a nursing home. We kept my father at home as long as possible until my stepmother could no longer take care of him in a proper manner, and he needed round-the-clock care by skilled nurses. So it can be in your home or in a nursing home or in what I call a assisted living community, continuing care community. There's a lot of cool things that are out there that are centered around fraternal organizations, religious organizations. There are even some centered around professions. There's a facility in Central Texas just for retired educators. So they're kind of neat. They're all over the country. You're seeing these pop up everywhere. I want to say they mask themselves, but they hide themselves as a senior living community. And you come in and you pay one price for your apartment, but you get to go into all of the meals, all the activities. And then as you need care, they have someone on site that can help administer medications, help do certain things as well. So it's really kind of a neat way to age in place in certain environments as well. Now, we talked about how you pay for extended care. And a lot of you said, I'm going to pay my personal savings or assets. Others said, I'm going to receive assistance from family and friends. Nobody said they want to enter the Medicaid program, and we'll talk about that in a moment. Then extended care coverage, long-term care, or some form of its type of policy. Those are options as well. We're going to kind of dive into each one of these because most people will have to spend down their own personal assets, or they're going to receive assistance from family and friends, and that impacts us in even a greater way. So we'll talk about that as we go through here, because you never know who needs it. As we get older, and as we saw with my father, the strokes kept him from doing things he can normally do. At first it was he just couldn't communicate as much as he could in the past. Then he got better and went back to work, did some things well into his 70s. And then it was things he couldn't do. Sometimes arthritis robs us of the ability to get dressed or to feed ourselves, things like that. And then I noticed in the first nursing home that he went into, there were people who were younger than me. And I was in my early 50s when my father went into his first nursing home. And I found out there were people who had had falls and had traumatic brain injuries or accidents, things like that, in their 30s and 40s. So you never know. You can't just wait until you need it to try to then get coverage. So it's hard to determine when you're going to need it. And some of the myths that we see oftentimes, and we hear this from people, is that my medical insurance will cover my care. If you're still working, you probably have really good medical insurance, but it's designed to get you back to a wellness point that the hospital discharges you and maybe you go to rehab for some degree. It's not designed for your long-term care once you no longer get better. Chronic care is what we call that. Some people think that Medicare covers long-term care. It covers very, very little, and I'll show you that in just a moment. Some people say, I'll just rely on Medicaid. Medicaid is truly a last resort. We'll talk about that. I'm too young. I can buy it later. I can tell you, I listen to Dave Ramsey a lot, whether you take his advice one way or the other. He talks about in that 50 to 65 sweet spot is the time to look at it from a cost perspective and making sure that it's something that's right for you at that time. My kids are going to take care of me. That all sounds great now until you're having that conversation around Thanksgiving and you've got your kids plus their spouses that say, who's going to write the $7,000 check this month? Who's going to take mom into their house? That kind of thing. Those conversations get real whenever it's time to take care of mom and dad. So you want to make sure you've got that planned out. You can always self-insure, again, to pay for it myself. Some things I've seen out there saying that if you've got a net worth of over 4.5 million, you can probably go ahead and self-insure. So again, your choice is out there. Some of these myths we're going to go ahead and dispel here in just a moment. Now, Mutual of Omaha is a company that provides long-term care through AMBA. Sometimes we oftentimes will get stats and data from them. They tell us that overwhelmingly women use long-term care benefits more than men. In an assisted living facility, it's 7-to-1 women to men. In a nursing care facility like my father went into, it was 10-to-1. And that's absolutely spot on. More females than males. Usually, and this is going to be because mama keeps dad at home for as long as possible. She wears herself out. He passes away, and now she has to go into a facility because no one can take care of her. The average age that someone goes on claim is 78. So again, when you calculate those numbers I showed you before, along with some of the numbers that Mutual of Omaha, one of the longest and most stable providers of long-term care insurance, provides us, you can kind of see when you may need to time out, purchase, or think about a long-term care policy from a cost perspective. And as I mentioned, long-term care coverage, the services don't have to be provided just in a nursing home facility. With the right type of plan, you can be taken care of at home or where you want to be taken care of, in a community, like I mentioned, like a continuing care community or a assisted living facility, nursing home. It doesn't matter. You've got the choice if you choose the right type of plan. The other thing, and this is where I appreciate it from my father's perspective, he chose a long-term care plan because it allowed him to stay at home as long as possible. It supplemented all of his out-of-pocket expenses so that we could keep him at home until we couldn't, but it didn't have to dip into the savings that he and my stepmother put together to keep her in the house and keep her in the standard of living that she had come accustomed to. It didn't force my brother and my stepbrother and stepsisters to take our kids' college funds and pay for my dad's care. So it protected those assets and kept him close to home in a facility, the quality that he deserved, that my stepmother could visit him every day after work. And one of those was because it had stay at home benefits. A good long term care plan can not only provide someone to come help you with household tasks, personal tasks like bathing and dressing, sometimes that good long term care plan can help provide equipment, adjustable beds, wheelchairs, walkers, things that can keep you at home as opposed to having to take you to a nursing home, and provide additional funds that can provide home modifications, things such as widening doors, putting pull bars or zero entries into showers, giving ramps up to the house. If just a few $1,000s could modify your home to stay at home, wouldn't you rather do that than having to go to a nursing home facility? That's what a good long term care plan can be built for you. And again, it's all depending upon your situation. A good long term care plan, just like I mentioned, a good hamburger can help you stay connected and stay at home because you can build it the way you want to. Now, I want you to grab a pen. I want you to write this down. Genworth.com, GENWORTH.com. And about two-thirds down the page of their home site, on their homepage, you're going to find this cost of care or CareNet calculator. It's really a cool tool. You can go in and plug your city, your zip code, your state, however you want to, plug in there that, and it's going to give you the average cost in your area. Now, these are the national numbers. They do this survey every year of nursing facilities and home health aides all across the country. The national numbers are $34 an hour to have someone come to your house to take care of you. Go to assisted living facility where you have your own private apartment. It's about $5,900. Then you move into a semi-private nursing home where you've got full around-the-clock skilled nursing care. $9,200. A private room is $10,006 on average. Now, those are the average numbers. Let's take a look across the country. We've got folks that have joined us from Chicago, from New York State, a lot of alumni, of course, in New York. Out in California, I took some state averages. Down here in Texas, I just took Dallas. You can see across the board, you're in your $30 to $40 range for an hourly home health aide. This varies even if you're in an urban area versus a rural area, depending upon mileage, things like that. Then you jump into the assisted living facilities and you see those numbers across the board, $5,000 to $7,000, depending upon where you live. Then you look at semi-private and private nursing homes. You can see these numbers go up significantly depending upon where you are. A lot of these are based on state regulations, availability, demand. All of these things make a significant difference. So again, calculate your costs. Go to genworth.com. Take a look at it. Genworth is one of the top providers as well. They do this survey every year. It gives you a really good picture of what that cost could be. And so you can make a preparation for yourself. Am I going to rely on my friends or family? Who's going to pay for this? Am I going to pay for it out of my pocket? Based on my family medical history, based on my situation, all these things, what's the best situation for me? Because when you want to pay, and many of you mentioned, 30 plus 40% of you said, I'm going to use my own savings. The challenge with that from a long-term care perspective is you may have saved up all of your money in a pre-tax device like a 401k or an IRA. And when it comes time to pull that money out, depending upon your age, you may have to pay taxes or penalties on that. It may be in a situation where, like we are now, where the stock market is zooming and you have to trigger taxes, but also you lose future earning potential. And you can't make that back up as quickly. Things like that. We've seen some people in land rich areas, in Texas and other parts of the country, we may have some family land. You may have to sell assets. We see people having to sell their homes, things like that, because they've got to take care of a loved one. Then some people say, you know what? I'm just going to give all my assets to my kids. I'm going to hide those assets. I'm going to go on Medicaid. I've had experience in this area. I can tell you Medicaid is really a last resort for people with limited assets. It's very much below the poverty line that they measure whether you qualify to be eligible to start with. They're going to do an exhaustive research to say, did you go in the past 5 years and hide your money with your kids or put it in a trust or sell your house and do something different? All of that stuff makes it very difficult to qualify for Medicaid. And then if you do qualify and go into a nursing facility, oftentimes the state will seek reimbursement from your estate once you pass away for what they paid for your care. And then anecdotally, the first place my father stayed was in Marble Falls, right outside of Austin. And his facility had three wings in the facility. Two wings were private payer, and they were well staffed, lots of activities, things took place. That Medicare wing, that Medicaid wing, I should say, not Medicare, that Medicaid wing to me didn't seem as heavily staffed. They weren't always included in the activities, things like that. Again, your facility may vary. I wouldn't want to put anybody in my family in a Medicaid wing. Let's put it that way. And it never made sense to me to work all your career and then have someone decide how you're taken care of the last few years of your life. That didn't make any sense to me. I'm all about control. My wife says I'm a control freak. Amber probably knows that as well because she's worked with me for a long time. I want to be in control of how I'm taken care of. And that's where a long-term care plan can do that. Now, a good group of you said, I'm going to have my family take care of me. I want to speak real quickly to caregivers in this situation. Unfortunately, no matter how much we prepare, about three-quarters of us are going to be taken care of by someone in our own home who receives no compensation. And usually this falls on the females in the household, the daughters, the daughter-in-laws, things like that, that have to quit their career early, that maybe stunts their 401k or pension or IRA growth, their retirement savings. It maybe takes away money from the kids' college fund, things like that. To take care of a loved one is extremely difficult. I watched my stepmother take care of my father until she no longer could. And the physical and emotional strain on her was difficult. Thankfully, he had some type of financial plan to take care of him. If not, it would meant something totally different. For females, this can cost $300,000+ out of their lifetime earnings. It can strain marriages. It can strain relationships with kids and grandkids. It can strain relationships between siblings. All of this to say is the impact of a long-term care situation goes beyond the financial aspects of it. It goes beyond where we get taken care of or where my parents get taken care of. It impacts the whole family. So when you just make a decision, don't think necessarily just about how you're taken care of. Think about how this can impact your family as well. Now, we get a lot of questions that say, doesn't Medicare pay for long-term care? I'm going to qualify this with a yes and a no from a couple of standpoints. Medicare does have some provisions to pay for limited care, but only if you have a qualifying hospital stay. And I want you to write down that word qualifying, simply because that word qualifying is very important. I'll share with you that in just a moment. Once you have a qualifying hospital stay and then you get discharged, you have to go to a skilled nursing care facility. You can't be discharged to go home. It has to be to a skilled nursing facility. Medicare, once you're age 65 plus, will pay for the first the first 20 days, 100%. Saw this with my father. He had a major stroke. He had surgery, got discharged to a great rehab facility. Medicare paid the first 20 days, 100%. After that, depending upon if you have a Medicare Advantage plan, a supplement, or something other than that, there's a coinsurance clause for the next 80 days. After 100 days, Medicare does stop paying altogether, and you're 100% responsible at that point. The tricky part is if somewhere along the way that rehab hospital says, dad's not going to get better, or you're not going to get better. In the case of my father, they said he can no longer go home. He is going to have round the clock skilled nursing care watch him. Once he no longer got better, Medicare stopped paying 100%. At that point, his long-term care plan had to kick in. So again, depending upon your situation and where you get to a certain point, if you don't get better, Medicare stops at that point. Now, when I told you about the qualifying stay, this is something that I don't want to say is tricky, but it really can make an impact. Once you're over 65 and you're on Medicare of whatever sort, you go to a hospital. If the hospital determines based on the Medicare coding that you are an inpatient or an out of patient or observation status patient, that determines whether you get skilled care after you get discharged. About a day and a half into your stay at the hospital, so even if you're already staying in the hospital, a discharge nurse will come to you with a clipboard. And that clipboard will say, you are in observation status. And that means you receive none of these skilled benefits after you get discharged. You sign off, you have to initial all these things. You can still stay in that hospital 3, 4, 5 days, getting all the great care that you deserve and you receive, but it's what happens to you after you leave the hospital. Every year, Medicare, in an effort to save costs, takes takes inpatient medical codes and moves them to outpatient status. So things such as a hip replacement or a knee replacement that in the past used to be considered inpatient care have now been moved to outpatient observation status. You'll stay in the hospital after your knee replacement, hip replacement, whatever that is, but then once you get out, all of your recovery is totally dependent upon you to care for yourself. So it does put you in a situation where you may need something else. And sometimes there are other options to long-term care. We have people say, long-term care is too expensive for me, or I don't qualify because of medical conditions, family history, or I'm too old to make it cost effective, something like that. There are other types of plans out there. They're called short-term care, recovery care, home health care that fill in some of those gaps. They may pay you weekly $1,000 for 1 year to help you get back on your feet and get your financial affairs in order. They may be for shorter periods that you can cover your elimination period. Some are home health based only. They can pay for someone to come out to your house and take care of you or give non-skilled coverage. All of these type of options are out there, depending upon the state that you live in. Some states have them, some states don't. I don't want to call them long-term care because they're not really long-term care. I call them short-term care type policies and options out there for you as well. There's some other unique ways to pay for long-term care, whether you have a long-term care plan or not. Some of you may have life insurance. You may have a term insurance policy that you've taken out, or a whole life or a universal life policy. Look inside that policy for a terminal illness benefit and or a long-term care benefit. These are free coverages inside a lot of life insurance plans, and what they do is basically accelerate the face amount. If you have a $200,000 life insurance policy, it may say you can get up to $100,000 or up to 50% to use for your care before you pass away. But then the balance of that policy goes to your beneficiaries. The one thing to point out about that, usually it defines as only nursing home care, not home health care or assisted living. You have to be confined to a nursing home care. So that's an option that way. There are some annuities or tax deferred asset protection plans that may have a provision inside of them that if you start to draw money off of your annuity and need long-term care, that you can double your payments. It's like an additional rider that you can buy. That's another way that if you have maybe a health issue or you've got family history of dementia or Alzheimer's like I do, that you could get long-term care without being able to qualify for long-term care because they usually don't have underwriting provisions in that. So there's ways that way. Required minimum distributions. Once you reach age 73, you now have to take money out of your pre-tax savings that you have and start to have to take that amount that goes towards your income. There are some ways that you can use your RMDs to pay for long-term care plans to do that. Another great way, if you're still working and you have a health savings account at work that takes out money pre-tax that you can put it in there, you can use that health savings account money that you're taking out of your paycheck pre-tax to buy a qualified long-term care plan. And that way you're basically buying a long-term care plan for you. The benefits that you would receive later on would be tax-free, but you're buying with tax-free money. So you're saving money on the front end. Another great way to pay for long-term care. And then some people will also look into a lump sum cancer, heart attack, or stroke policy that would pay you $50,000, $75,000 if you had a heart attack or a stroke or a cancer diagnosis, and use that money towards your care. So those are just some unique ways to pay. Again, your mileage may vary how you want to choose that as well. All right, we've had a lot of questions that have come in. Thank you for being with us today. Thank you for walking through this with us. I want to point out a couple of resources, and then we're going to go address some of those for you. Through RAA, through your alumni plans, you can go out to raa.alumniplans.com and see all of the benefits that you have available to you. Often these benefits are discounted or easier to qualify for because of the fact that you are a member of the Alumni Association. You can also call LTC Resources. They are a great group that can sit down and just discuss with you what your current situation is, how it works, what could be right for you based on your age, help go through a fact finder, things like that for you. Call them at 844-582-7587. It's a super easy way to go check those out. Start at raa.alumniplans.com. Then if you need to, you can get a hold of LTC Resources through that as well. It's a great way to do that. All right, Amber, we've had a lot of questions come through here. Let me open this up. I'll let you unmute if there's some that you want to answer here. I'll read a couple of these out here. Someone asked about long-term care covering Alzheimer's care. Do you want to answer that question, Amber, or you want me to answer that question?
You have more experience, so definitely qualify my response here. But it depends on the policy and if it's a pre-existing condition. But what I really encourage is to reach out to long-term care resources. Um, there's a lot changing in the industry as far as dementia and Alzheimer's care. And there are different options available, and they really do take a consultative approach so they'll be able to meet your family's individual needs.
Okay, great question and exactly right. Joseph, you could have an old policy that you've had in the past, and usually it has no restriction for Alzheimer's whatsoever. But now, these days, newer policies may offer coverage for everything but Alzheimer's. And so, again, different situations. The biggest thing that I noticed in the past when I've looked at coverage for individuals is they're going to ask some questions. And a good long-term care plan, someone will call you if you apply, and they'll ask you questions. They'll ask you what's today's date, who's the president, some other things, 3 words, and then they'll go through the interview. And then about 10 questions later, they'll ask you the same thing. They're probing to see if there's some early dementia, long-term care, or early Alzheimer's, those type of things. This is probably the most costly expense to long-term care companies, so they're making sure that they properly underwrite a policy. So, as Amber mentioned, calling LTC Resources, they can review a policy you already have, but they can also sit down and help you understand how it works, what is covered and what isn't covered as well. But that's a super question out there. Okay. All right. We had a question that said, why are home health care reimbursements so low versus in-care facilities? You may be referring to the Genworth cost of care. That's not a reimbursement. That is a average cost that's out there. So home health care is less expensive, or it's hourly based in there. So you've got those numbers that are showing up there as far as what the actual costs are. What we do see in some plans, and this was a question that Jay asked, some plans, especially in the pool of money plan, will say if you need home-based care, you have a certain dollar amount that is based for home-based care. Meaning if you've got a $300,000 pool of money, you can designate 30% or $100,000 towards your home-based care. So that is a good question, but that's a way, because home-based care, sometimes they define it as somebody who's got skilled nursing care or non-skilled, things like that. Okay. All right, let's see some other questions in here. Some super questions that have come here. One says, all right, this is a neat question from Peter. Assuming you don't care about leaving an inheritance, okay, and that's another subject altogether. How much do you need to have in investments to feel comfortable self-funding long-term care for a couple? I go back to my Dave Ramsey. I spend a lot of time on the road. I listen to Dave Ramsey on the radio all the time. He says about $4 to $5 million of liquid net worth is what he feels comfortable with a couple self-funding for long-term care. So again, your mileage may vary. A lot of it depends on how you want to be taken care of. My wife have taken a similar approach, and we have nowhere near that situation. We have put our long-term care plan into an annuity as part of an annuity so that if we need it, we have the ability to draw off double of the annuity. If we don't need it, we then have our annuity savings for that. So we've designated a portion of that question there. So there's a lot of questions in here about family members. Um, a good question when it comes to family members. We talked about home-based care. Will a long-term care policy pay family members to care for their loved one? Most long-term care policies require that you have a skilled nursing care provided to you, whether it's in a nursing home or whether it's a home health aide coming out to your home. So I have not seen a long-term care. LTC resources may have something like that, where they can offer um, it for a loved one to come in. I haven't seen it. However, I did mention some of those short-term care policies and those home health care policies. Some of those have non-skilled care provisions within them that would pay a small amount towards someone coming in to cook and clean and do things like that. But usually it is so limited. So again, there are certain situations that's important that can take care of that. All right, here's a great question, Timothy. You just sent this one in. This is one that I need to learn more about, but I want to bring this subject up. There are some states. I don't know where you live, Timothy. I'm thinking about Washington State as one of them,
I
where
think
they
so.
tax long-term care. They take it out of your salary, and so they have then a state-covered long-term care plan, but it only gives you a certain amount. Most of those states still have private long-term care policies that are available to you, but most don't have a short-term care or recovery care type of a policy available to you. So again, those states that do have state long-term care plans, you can see how they're very, very limited, and long-term care options are out there. When you apply, the long-term care company will know what state you're in, and they'll have a plan that fits accordingly. So, all right. Got a question from Lisa. This is a good question. We'll take just a couple more here. If I have an existing plan that's been in place for about 5 years, does it make sense to see if there's a better value? All right. Great question. I'm going to take this, Lisa, from two different perspectives. Most of the time, you have qualified medically for this policy and you qualified when you were younger. So it doesn't make sense usually to go look for a new policy because it's going to be age based and your medical conditions have changed. But LTC resources can review that with you and point out some things that are in there that may make sense to you or may not make sense to you. We have done this for quite a long time on the AMBA side, and we have found a lot of retirees that I work with mostly took something out during their working years, and the policy fits great for them, but they had a large elimination period that now they find out it's $10,000 a month for nursing home care in their state. They may need to take out a short-term care plan that covers them for 3 months or 6 months. So, Lisa, that's a super question. That's why it pays to review your benefits, find out what does and doesn't qualify to go on claim, and to make sense. To say it's a better value to make sense, yes and no. Usually it doesn't 5 years later, but again, that's why it pays to make sense there. Okay. Then here, I'll take this last question. We've got a bunch. We're going to respond back to you individually, make sure we respect your time. Someone asked, if you've had cancer, do you qualify for long-term care insurance? Super, super question. This one is what really makes weird, perverse sense. If you've had cancer, usually you can't qualify for a lot of policies. But most of the time, depending upon the type of cancer and how long it's been since you've been diagnosed with that cancer, it has no impact on long-term care insurance. What usually they're looking for is arthritis, some type of knee or joint replacement, some type of Alzheimer's, dementia, family history, something like that. Those are usually the disqualifiers in a long-term care plan. Usually commercial, or excuse me, cancer insurance has not been a disqualifier, having cancer. So really super questions out here. Thank you so much for that. We've had questions about range of monthly premiums for a policy. It's all age-based, health-based. I've seen them as small as $150 a month for a plan, up to several $100s a month. Again, depending upon the age and the amount of coverage, it's all very individualized. And then depending upon the length of care, elimination periods, things like that. Again, super, super questions that's come through here. I greatly appreciate these questions. Some of these things, some people ask about all different 50 states. Again, most of these plans are available. Depending upon the state, it depends on the coverages within inside of that are out there as well. So, some people have asked about being turned down in the past for long-term care based on previous conditions. I would advise you, especially in this particular case, reapply. It doesn't hurt to reapply because some of those things have changed. Sometimes, too, this is something very clear. Now, this will be my last question to point out about prior um, declination of coverage or maybe current uses of medication. Sometimes certain medications are automatic triggers to an underwriter for long-term care that you would not be eligible. But sometimes the doctor may prescribe the particular medication for off-label usage. And with the doctor's note could say, hey, I'm prescribing this for this use, not for what you think it's normally used for. We have seen plans that have been approved as a result of that. So super, super good questions out here. It pays to at least to contact LTC resources and have them do an analysis. Sit down and look at it. You could be enough to be self-insured, family history, all these things are important out there. Amber, I'm going to let you have the last word today. We've got over 100 folks that are on the call today. You've done a yeoman's job answering these questions. We're going to answer some as well in the future, get back to individuals who've left their email address. Anything that you want from your experience dealing with this that you want to leave with our RAA members today?
Um, Something that I learned early on about long-term care insurance when I was becoming licensed is how long it takes from the beginning of talking with a couple or individuals as they're planning for these stages of life as to when the policy is actually written. And that's not because they don't qualify. That's because so often this is a very personal and consultative approach. And so you're going in, you're getting a lot of information, and there's not a pressure to go down a path that's unnecessary. People are really trying to find your needs for your family based on your age and your stage and your circumstance. So make sure you're offering up as much information as you can, and then that person will be able to give you options that best meet your needs. And if it's not something you're comfortable purchasing, then you don't have to. But certainly going to the table and getting the information could empower you and your family to make choices that are best to meet your needs.
Absolutely. Thank you, Amber. Thank you very much. Thank you all for joining us. I'm going to stop recording, but I'm going to leave this up for a while. If you want to put more questions in there, Q&A, I can type some responses back to you. We can follow back up with you. But thank you so much for joining us today. Thank you to RAA for thinking of you as alumni to bring this topic at hand. If you've got more topics you want to discuss, please reach out to Dawn, your executive director of RAA, and tell her, hey, we want to find out about this. Amber and I will put together something to help you out. And always, we're lifelong learners, and we want to share that information with you as well. Have a tremendous rest of your week. Thank you for joining us today, and we look forward to serving you in the future. Take care, everyone.